the need for treating patients with venous insufficiency was so huge. There were so many patients who had almost crippling pain in their legs because of venous insufficiency, and they just were not being treated, that their need was not being addressed. Right here in the Washington, D.C. area at that time when we started, there was nobody treating venous insufficiency. And then as we got further and further into it, we realized that this was a massively undertreated disease throughout the country and throughout the world. And a lot of research had to be done. A lot of new technologies had to be introduced. And again, when we got into it, we did not know how undertreated this subset of patients was. And then as we got more and more affirmation from the patients that, wow, this is making a huge difference, that's when we started to expand. And during this expansion, we also felt that a lot of the things that we do don't really help patients the way we intend to help them. And consequently, we at that stage got into research in a big way. And as we got into research, we figured out that treating venous disorders is not as hard as it might seem. In a lot of places, it may be a lot less that needs to be done. And some other places, what we had to do had to be changed a little bit. And here we are. So the early version, as anything, when it starts, right, it's like a little small family where the one physician who I was earlier, and then we get a couple of other physicians, all the people working within CVR, everybody knew everybody knew everybody's kids. And same thing with the patients, right? We were very, very close to our patients. And then as you scale, that despite your best efforts, that close relationship is just not humanly possible. So scaling has its own pros and cons, but we have tried our best to keep that atmosphere more now at every clinic and sister site and regional levels. I think the quality of patient care we are providing has only improved because of the quality of doctors we brought in, quality of research, the fellowship program. So I think the CVR of today, while may not seem as close-knit as when we were just 10 people, it's definitely providing very good quality care, dare I say, even better quality care when we started, to a lot of people all over the country. Oh, just one. We had one office right here in Greenbelt, Maryland. We are in 22 states now. We started with just one, that's me. Yeah. Now we are at almost 85. So in the first year, at that time, we were a full-service cardiovascular program. So on the venous side in the first year, and I'm just guessing, we probably saw 100 patients. Because again, we were primarily catering to the entire cardiovascular system. Now we have over 300,000 patient interactions a year. Where do I see us in the outpatient setting? I see us in the next 2 years expanding to almost twice our current size. We will, and the way I would define expansion is not just a number of sites, it's got to be defined by how many lives we touch. Now, whether we expand to 30 states or 35 states, that's really, in my mind, secondary. It's just, like I said, how many patients we can heal. We have just entered this partnership with a hospital system in New Jersey, and that will be our flagship, where we want to prove the concept that within hospital systems, we can bring a lot of value. And I think that'll take about a year, 2 years to prove that. And once we prove that, then our goal is to take that to other hospital systems within the country where we can treat venous disease within a hospital system. From an e-commerce standpoint, we feel that, we're buying everything off of the internet now. But what we will provide, what we are providing now, is a unique combination of physician care through the internet. So it's almost like virtual care, telemedicine services. So even if somebody just wants to go and buy a pair of compression stockings, there is a virtual consult available to them, a virtual just quick consult available to them. Because if I'm somebody who doesn't know about compression stockings and I want to go buy compression stockings, I am so lost in a compression stocking store that do I need 15 millimeters of compression? Do I need 25 millimeters of compression? Does it matter whether it's knee high or thigh high? And that's where our store is different. We are also going to be providing lymphedema therapy units to patients online. And this will be a one-stop complete service provider to almost 20% of the population that suffers from venous insufficiency. So I think in the next 2 years, our online platform will see a lot of growth, and we'll be able to serve a lot of patients that way. So CarePoint Health is a health system in New Jersey, in Hudson County, New Jersey, and they have invited us in to provide, again, our services to the county and through the hospitals. And that's what we are going to do, be very respectful of the citizens of the county, and that there we're going to provide services as a larger vascular and vein program. Truly want to create a state-of-the-art limb salvage program in Hudson County, both on the arterial and the venous side, covering all three of their hospitals, which is Christ Hospital, Bayonne Hospital, and Hoboken Hospital, and truly partnering with the administration, the medical staff, and all the people who work at CarePoint Health System to provide absolutely state-of-the-art, second-to-none vascular and vein services to the citizens of Hudson County. This will be an integrated effort with all the primary care doctors, all the cardiologists, all the interventional radiologists, all the vascular surgeons in Hudson County, under the auspices of CarePoint Health Partners. That is how we will be providing services in a very integrated way with continuity of care. So, and see, again, when it comes to vascular services, if the patient is overall not taking care of themselves, if they're not taking care of their weight, if they're not taking care of their diet, if they're not taking care of the coronary disease that is associated with that, the endocrine disease that is associated with that, then we are truly not helping the patients. And as a whole hospital system, trying to make our patients healthy, that's a unique approach that we will all be trying. The next element I talked about is CVR's management services. We do feel that with the state-of-the-art medical records we have, the state-of-the-art e-commerce store we have, all the research we are doing, all the fellowship education we are doing, we hope that we will also be able to take all these services to independently practicing physicians within the country who will be able to use these management services to further their delivery of care to their patients. A model of service delivery where an independent physician just wants to use the CVR management platform to deliver their care. I think the way technology has progressed is absolutely amazing. It keeps getting, so when we all got into treating venous disorders, it was still treated as an open procedure 20 years ago, right? And then the curve was pretty flat as to how many patients got treated because of the morbidity associated with the treatment. And then you get to a stage where minimally invasive procedures came as radiofrequency ablations, and all of a sudden it started skyrocketing. And because the disease was always there, it was just not being identified and treated because the treatment may have been more morbid than the disease. And now with new non-thermal technologies that have come, they have made this even less invasive. And I feel, again, lifestyle treatment, improvement always remains the key of whatever treatment, whatever disease state we want to treat, make people better. But in addition to that, the less invasive a process becomes, the more people adapt that process and the more people we can touch. I truly don't think we have to go to any kind of management school or anything to come up with a certain culture, right? You just have to surround yourself with people who are good, happy people who want to make other people happy in whatever field you're in. You could be selling shoes, you could be operating on people's hearts, you could be whatever you do. At the end of the day, we're all in the field of taking care of other people. And as long as we continue to do that, we all have bad days, and that's when we feel, hey, who's taking care of me? But as long as you're surrounding yourself with good people, the culture truly takes care of itself. Now, one bad person in the whole chain can really hurt the culture. And I think if there's something which I think our leadership has done really well, is keeping the good people in and the bad people out. You don't have to teach, that old saying, it's not light that takes darkness away. It's just the absence of darkness that brings light. So it's the same thing here. It's just if you have good people, they will spread joy. We do a lot sitting here in the boardroom. We make amazing plans. Our leadership is very, very engaged. We are very excited about the future. I just want to make sure that all the plans we make here truly get to everybody in every clinic. Everybody who is a part of CVR should both feel, first of all, they should know what all we are talking about. And secondly, I want to see the excitement in them, right? I think it's my job as the leader in this area that I need to give our employees a real reason to continue to give their dedication to CVR. And my main mission is everybody who comes to Vision from within CVR should leave feeling, wow, this is the kind of organization I am committing my 1 year, 2 year, 5 years, hopefully 10, 15 years to. And it's just that communication, right? Without these meetings, and the communication is not just at a professional level, at a personal level, what kind of people am I working with? So it's just open communication is my primary goal within CVR. For the part that we do where we have physicians visiting us from outside of CVR, it's the same thing, right? It's if the world doesn't get to truly know all the work we are doing here, then shame on us. And also, we need to know from them, a lot of the luminaries will come, that what are they up to? It's like a conference at the same time where there's exchange of ideas, but we can clearly go to other people's conferences. Here, for people coming to our conference, we also get to showcase everything we are working on here.